these are not hard to get right now. So we have, different types of them. Like this one here is a sodium chloride. So in this format, these are the little small volume deliveries. These are hard to get, but we can get the bigger ones. So another option we haven't had to do, but what we could do is use a bag, empty bag, get a small empty bag, fill it with the sodium chloride, and use it as one of these or something similar to that.
Yeah.
We'd have to add medication by ourselves, but
Yeah, and so would, I mean, other than the size of the bag, would patients notice any?
no, I don't think they come into an
going on?
expectation of
Yeah.
what type of delivery we're going to use. They're just laying there and knowing that they're getting the medication. The nurse will go in and explain what the medication is, what's it used for. Because there's different ways we can do it. What we haven't had to get to, I know some hospitals are going to, is what's called an IV push. So they use it in a syringe, and the nurse kind of has to stand at the bedside for 3, 4 to 5 minutes and just kind of slowly push the medication in. More nurse intensive, so we don't really want to go to that, but there's nothing wrong with doing it that way. It's just more work on the nurse's standpoint. We don't want to. Where these other ones, they hang it, put it on a pump, set the pump to infuse over, say, 15 minutes, half hour, whatever it is. So it's a lot easier that way. So if we can stick to that way and not change a lot of the workflows, it makes it easier on everybody. But that is something that, if we have to, can't get the bags, can't get empty bags, can't get dextrose, saline, anything like that, then we'll look at other options, which IV push is another option. But again, a patient, they wouldn't really know what to expect when they're getting a medication, whether a nurse is pushing it in or it's hooked up to a pump. They're still getting the same thing.
Any word on when maybe changes might be in terms of getting, I guess, the easing of the shortage, or?
Well, we're hoping by the end of the year, but again, that's not been really determined. We got some information from Baxter saying that some of the products will come out get full production by the end of the year. But right now they haven't told us which products those are. So it seems like they're giving some allocations out to kind of base it off of what you've ordered in the past. So if you ordered 3 cases a month, they'll try to give you maybe 50% of that, something like that. So we are still getting some product in. It's just not as much as we would like. So we're looked at, like what I talked about before, using some frozen products or just different dosage forms to kind of get by.